We are going to jump into microbiology. I love this part of the course. I love talking about all the science things. So, what is microbiology? Microbiology is the branch of science that deals with microorganisms, including the structure, the function, and the modes of existence. What are microorganisms? They're simply microscopic organisms, the things we cannot be seen by the human eye. So we, as technicians, are dealing directly with blood of our clients. We are breaking the skin. We have to know how cross-contamination can occur in order to keep ourselves safe, in order to keep our clients safe, and in order to keep our future clients safe. So we have to know how these things work. Bloodborne pathogens are infectious microorganisms that are in the human blood and body fluids that can cause disease in humans. These pathogens can include hepatitis, HIV, anything that is in the blood that is infectious to us is considered a bloodborne pathogen. Okay, that is why yearly we have to be trained in bloodborne pathogens, because directly dealing with that blood is we have to keep the public safe and ourselves safe. So I'm going to walk you through what has to happen in order for the spread of disease to happen. And disease, sickness, the common cold, all of those things happen this way. So I will say it's funny because when we, of course, started this course 6 years ago, it was prior to COVID. So now walking through COVID, I feel like we all have a much better understanding of how these things go, right? So you can think of it in that way if you want to. So the first thing that has to happen is there has to be a mode of transmission. Okay, the mode of transmission is the method of transfer from the host to a potential new host. And this can occur through a transfer of fluids. So I'm going to give you guys a scenario. That way, for each one of these, I give you an example of what that looks like. So let's say you, as a technician, have a client that comes in that has hepatitis C but is unaware. They don't know that they have it. Okay. So the mode of transmission is there has to be a way for that hepatitis C in your client to affect you. Okay, what is that going to be? We don't know yet. We're going to talk about it. But there is a method that it's going to get from the potential new host, which is yourself, to the current host, which is your client. Okay, so the susceptible host is the potential new host, which is yourself in this situation. And they, in order for you to be susceptible to getting hepatitis, you have to have one of two things. You have to either have a weakened immune system, meaning you're currently maybe battling something else. Maybe you're coming off of a virus. Maybe you didn't get enough sleep last night. Maybe you drank too many margaritas last night. Something happens where your immune system is not optimal at the time, okay? The other thing that has to be, that could be present to get you hepatitis C, is that the pathogens are in a large quantity. So a large amount of those pathogens leave the host and get into you somehow. So one or both of those situations has to occur in order for you to become a new host of hepatitis C. There has to be a portal of entry. So there has to be a way for the microorganisms to enter into your body. So either it's going to be through a cut, through your mucosal tissues, through your GI tracts, through your respiratory tract, through your eyes, or through a vein puncture. So there has to be a way for that disease to enter your body. Reservoir, this is just another name for host. So this is your client. This is the place of origin that the organism is currently living, whereas hepatitis C currently living, it's in your client. They are the reservoir. The reason why pathogens like bodies to live in is because our bodies are warm. There is no light. There's always a source of food. And it is moist. So perfect, ideal place for an microorganism to live.
So what would the source of food be? Would that be your cells?
Our blood, our cells, whatever is
Whichever
it's using for food. Yeah. And then causative agent, there is the actual virus or sickness or disease itself. So in this case, it's hepatitis C. And then there has to be a portal of exit, which is the way that that has to leave their body. Okay. So let's say, for instance, you're working on your client, you are, they're laying on the table, you have done your first pass over their eyebrows, you are getting some more pigment, and you fumble and accidentally drop your machine and you stick yourself in the thigh. Okay, so now the portal of entry is through that needle stick. The mode of transmission is your machine. The needle on your machine is what transferred it to you. And the portal of exit was when you used the needle on your client and it got onto the needle got onto you. Okay, does that make sense? Yes.
The way you said it has to be like a lot of the pathogen, is it the same for HIV, or is it like it doesn't have to be as much? Or...
HIV is the most contagious of all bloodborne pathogens. So I would say for that one, it is probably not very many pathogens.
Okay.
But yes, there still needs to be enough. So
still scary.
Still scary.
Be a drop, right?
Yes, yeah. And as we'll go through hepatitis quite a bit because your test will talk to you about hepatitis. But I think I have it on a slide, but I think there's like 40% of us carry antibodies towards hepatitis already, meaning we have came in contact with those pathogens and our bodies were able to fight them off. So if your immune system is really low or you come in contact with a lot of them, that is when you can contract it yourself. So when I talk about these things, so this was my undergrad, so I love this type of stuff. But I always had to imagine things differently when I was learning them in college. So your body has a reaction to when it comes in contact with pathogens, and typically it's white blood cells are the first things that, or T cells that come to like attack the pathogen that enters your body. And I always thought of them as ninjas. This is how I teach my kids too. And so when the pathogen comes in, the ninjas there has to be enough ninjas to take out the pathogen, right? And if you don't have enough ninjas because your immune system is low, or there are too many of the pathogens, too many of the bad guys, that your ninjas can't fight them off, you end up getting the sickness.
That's cute.
Does that make sense? Yeah. So this slide just kind of reiterates what I was telling you. Susceptible host is yourself. Portal of entry is how it enters your body. Mode of in terms of this situation. Now it could be, I'm using this as an example, but it could be your next client that's coming in. It could be your family at home. It could be other methods of, I'm just using that as an example. But the susceptible host is just who could potentially get this sickness. Okay. Portal of entry is how it got into that person's body. Mode of transmission is the method that, and we'll go into this one in a second, but the method of transfer. Portal of exit is how it left the host. Reservoir is the host. Pathogen is the sickness itself. So at any time in our everyday life, we have potential to have both of these present on our bodies. So our skin its job is to keep bacteria and sickness out of our bodies. It's a really, really good barrier. So it has sometimes, well, all the time, it has resident microorganisms that are on our bodies all the time. These are typical organisms that we always have. They're consistent and they're found on the top layers of our skin. They're not usually harmful at all to us, but they can be harmful if the colonies themselves are not consistent. So if something disturbs the consistency. So staphylococcus, when somebody gets a staph infection, we have staph on our skin all the time. It's our own staph, and it's at a very consistent amount all the time that's on our body. When it becomes dangerous is if you have a cut or you have a way that the staph entered your skin into a place that it's not supposed to be, then it can cause an infection because your body's not used to the staph being at that place. Also, if you take antibiotics, it kills off that staph and that strep, which our body needs and it has to have. So it comes back, and it comes back usually in excess because it's trying to replenish those colonies. And so that's why after you've been antibiotics, sometimes you end up with different type of like you can get thrush, you can get a yeast infection, all of those things can happen because it's your body trying to repopulate those colonies. So staph and strep are not dangerous on yourself, but they are dangerous if you are spreading them to one of your clients, right? Or if one of your clients is giving you their resident microorganisms. We don't want that. That is why we have to always super clean in between clients, just because us being who we are can affect somebody else when we are breaking open the skin. Then we have transient microorganisms is the other type of organisms that could be present on your skin. Transient microorganisms are recent contaminants that are from other sources than our normal flora. So flora is our typical colonies that are on our skin. Transient ones are not typical. It means we've came in contact with them from somewhere, and they can't survive for very long. They can be infectious, and they can be simply removed with proper hand washing most of the time. So simple cleanliness can get rid of transient microorganisms. Typically, they are on our hands because we're opening doors, shaking people's hands who have just sneezed into their hands. So once again, this is something that we understand all a lot better with COVID. So these two things are just to remind us that we need to keep our spaces clean, because you never know what somebody could be accidentally bringing in to your space. But we do know that they always have resident microorganisms. So that is why we have to clean our clients' faces before we start a procedure on them, because we need to wipe away some of those colonies. You never want them to end up with a staph infection because you've opened up their skin, and some of their staph could get in it and cause a bigger issue. So there are 3 different ways that these organisms can be transferred between a host and a susceptible new host. The first one is direct contact. So this is it's directly from the host to the potential new host. So for example, if you are working on your client and you happen to have a cut on your arm, so it's a break in your skin, and they have, you accidentally get some of their blood into, or the pigment containing some of their blood into your cut. That would be direct transfer. Could also be that it squirts into your eye or into your mouth, something like that. Could get that into your body. Indirect contact is the organism is transferred from an infected object to the potential new host. So this is the example I used with your client with hepatitis C. You accidentally stick yourself in the thigh. That is indirect contact. There was an object that transferred it. And the last one, which is not very common, is airborne transmission. So this is that the organism is transferred into the air and the potential new host inhales it into the respiratory system. So tuberculosis is the disease that directly corresponds to airborne transmission. There was, with COVID for a little while, that people thought that it was airborne. It actually wasn't, but that is a way to get sicknesses. So hepatitis. So you will be tested on hepatitis on your test. I don't know anybody who didn't have at least one question on hepatitis. Just know that it directly affects your liver. Hepatitis is associated with liver. And there's a lot about hepatitis that we don't exactly know. There are quite a few different types of hepatitis, and it's been studied for a while, but it's kind of a strange disease. So you can get it from certain viruses, certain bacterias, alcohol abuse, certain medications, even trauma can cause hepatitis.
Is that like cirrhosis of the liver can give you
Uh-huh.
hepatitis? Oh,
Yeah. Mm-hmm. So the symptoms are mild fever, headache, muscle ache, fatigue, loss of appetite, abdominal and gastric discomfort, jaundice, liver enlargement, clay-colored stools, tea-colored urine. Can be mild or long-lasting depending on the kind, can lead to cirrhosis, chronic liver dysfunction, or cancer. So the first one we're going to talk about is hepatitis A. Hepatitis A has to be transmitted through the fecal-oral route. It is found in contaminated water and food. 50 to 75 of adults in the US have positive antibodies. So that's the one I was telling you guys about. So more than half of the United States has been in contact with hepatitis A, and we carry antibodies for it already, which is pretty gross if you if you think about it, because it has to be transmitted fecal oral route. So proper hand washing is important. The incubation time is 3 to 5 weeks, and the symptoms can take up to 2 weeks to show, which becomes incredibly difficult to track down how and where somebody would have gotten it from. When I was in high school, I got Shelby and I both got salmonella poisoning, and we have no idea where we got it because we had it. They wanted, by the time they found out that I had salmonella, because I'd been to the doctor, I had to get 3 bags of IVs put in me because I was so dehydrated. But they it had been 3 weeks, and they said that it lays dormant in your system up to 9 days prior to when you're sick. So they wanted me to remember everywhere I had been and everything I had ate, you know? So I think about this, with 5 weeks taking 2 weeks to show, I mean 7 weeks, you have no way to remember where you came in contact or how you came in contact with it. So hepatitis B it has a longer incubation period of 6 weeks up to 6 months. So that one's even harder to try to remember, and has been reportedly harbored for up to 15 years. Mm-hmm. So it occurs worldwide, typically can lead to liver cancer if untreated. It can be direct or indirect contact transmission. Hepatitis C has to be direct percutaneous exposure to blood. It has to be direct percutaneous exposure to blood. So typically drug users, people who deal directly with exposure to blood in their occupation, like us, mother to child transmission during birth, and hemodialysis patients, which isn't nearly as common anymore because now blood gets tested much more accurately. Those are all typical for people that get hepatitis C. Most cases lead to chronic liver disease. In over 50% of cases of hepatitis C, they end up with chronic liver disease and require a liver transplant. People with both B and C can develop life-threatening severe symptoms. Hepatocellular carcinoma is the type of liver cancer that you would get from hepatitis C, and medications do help. Hepatitis D it's caused by getting the Delta virus first. So if you get the Delta virus, you're susceptible to hepatitis D. It is an incomplete RNA virus that requires helper functions of HBV for its replication and expression. Only occurs in individuals that have HBV positive and are in the acute or chronic phase. And potentially severe disease that is common among people who are frequently exposed to blood and may or may not be sexually transmitted. They don't know. And hepatitis E is the last one. It's referred to enterically transmitted non-A, non-B hepatitis. Does not lead to chronic hepatitis. It's transmitted fecal oral route, and pregnant women are the most susceptible. Most of us have heard of MRSA. MRSA is what we talked about earlier with we all have staph on our skin, but there's particular strains of staph that are methicillin resistant, meaning they are completely resistant to any sort of antibiotics and can be spread very, very easily from person to person. Typically on the skin or in the noses of people, can enter the skin through cuts, abrasions, wounds, tattoos, body piercing, or surgical incisions, can be mild or serious. Most strains are resistant to penicillin. So actually studying MRSA is really crazy because the whole goal of any sort of virus or disease is it wants to live, and so it will change and mutate in order to be able to live, and so it produces a type of enzyme that will break down um, penicillin when it comes in contact with it, and so then they started um, giving different antibiotics that are not in the penicillin strain, and it broke those down too. So they're constantly having to change the type of antibiotics, and there's constant research that's going into MRSA because super strong. So putting these in terms of how I talked to you guys about the ninjas, MRSA is like a super hero in there because it can produce anything to break down. As soon as it comes in contact with those antibiotics, it learns what they're made of and it breaks them down, and so it won't affect them anymore. And so it's crazy to me. MRSA it's a crazy thing. So it's constantly evolving. It's always changing and evolving. You would hope that your client would eventually tell you if that is something that they had, but typically you see it in hospitals. That's definitely like the most common place, and it can attack at the surgical incisions. But when you think about that, in hospitals they are incredibly clean, and it still runs rampant in hospitals. So we have to be very, very careful. um, so it can be present in forms such as, and we'll talk about this, but cellulitis, impetigo, folliculitis, furunculosis, carbuncles, abscesses, and infected lacerations. So these are all um, issues that you can get on your skin from having like an infected hair follicle, or a couple different hair follicles that get infected, or cellulitis is just inflammation of the cells, the way the skin has been infected, and staph can enter it at that point. And if it is MRSA, which is staph, it's methicillin resistant, then it can cause a bigger issue. So the biggest issue is that it can affect your heart if untreated. So because it goes into your blood. So direct or indirect contact can transfer. If a client comes in with it, you could easily have it affect another client if you're not careful. Symptoms are mild at first, and if unaddressed, can be serious. Pimples, rashes, pus-filled boils are all the beginning stages. So it would essentially, a staph infection or more severe MRSA infection is just going to look like a really infected pimple area. So that's what it starts as. If untreated, it can turn into severe skin infections, prolonged illness, rare life-threatening illnesses in the blood, heart, and bones. We had a student that came through that she had been an IV drug user, and she had MRSA, and it had gone to her heart lining, and she almost died. And she was telling us all about it and how painful it was, and it's so scary. But she's okay. So fever, chills, muscle aches, basically you could feel like you have the flu, chest pain, shortness of breath, heart infections, toxic shock syndrome, and septicemia all could occur and can be treated with different options. They're constantly, like I said, throwing different antibiotics at it. So there are sets of precautions and guidelines for health workers, ourselves, in order to prevent the transfer of disease. These precautions should consistently be used with all patients and clients. The technician should handle every client the same as though they have an infectious disease. So we want to prepare for all of our clients to essentially have something. That way we are taking the proper precautions. We are dealing with sharp instruments that penetrate the skin. There is always exposure to blood, whether visible or not, and can infect anyone it comes in contact with, yourself or your future clients. Unseen blood can contaminate your work tools as well as anything the technician touches after they have touched the client and tools that have touched the client. So universal precautions, this is the practice of avoiding contact with bodily fluids by means of wearing non-porous articles as protection. So for example, gloves are a form of PPE, so personal protection, that we are always we have to follow a certain way of keeping ourselves clean and our spaces clean in order to protect ourselves and the public. So in order to do so, there are two different types of technique that we have to use. The first is medical asepsis, which is the act of reducing the amount of organisms that could be present. The second is surgical asepsis, which is the proper handling of our equipment. So we are, as you guys are beginning to step into this, you are making the decision to follow these rules of medical and surgical asepsis in order to keep everybody safe. So there are steps that you can take to practice proper medical asepsis. So that's what we're going to get into first is medical. So medical is how to keep your space clean, how to keep yourself from getting sick and your future clients, your families, and then we will get into how to keep your tools clean. So the most important precaution a technician can take in order to prevent the spread of infectious diseases is simply hand washing. So this is, once again, what we all learned with COVID. It needs to be done properly with a proper soap in a stream of water. So I have to tell you guys how to wash your hands. Surely we all know how to wash our hands. I feel like with COVID, they were teaching us how to wash our hands, which I was confused because I thought we all knew this, but apparently we didn't because everybody's still getting sick. So you have to wash your hands before and after every procedure. You need to wash them before you apply gloves, immediately after taking off your gloves. This is why it's handy to have a sink close to you or available. If any sort of contamination occurs that you think you could potentially have been contaminated, of course, take time, go wash your hands. After any contact with blood or pigment that could contain blood matter, after eating, after smoking, before putting on your gloves, immediately after, if risk of contamination occurs, or after leaving and returning. You should try not to touch your face, your hair, or your phone during your appointment. Very difficult to do that. So if you do, try to either re-glove, or you can wipe your hands down with a cavi wipe, but try very hard not to. Just try not to. It's something you have to learn how to not. You don't realize how much you touch your hair and your face and your phone. So the duration of washing your hands needs to be 40 to 60 seconds. Make sure you're washing it long enough. The correct method is you rub your hands together with a strong lather of soap, rub rotationally, as well as interlacing your fingers. You guys should know this, but I still have to tell you. So focus on your fingernails and surrounding areas. Of course, shorter fingernails harbor less microorganisms. Remove all your jewelry. Rinse under a stream of water. Dry with disposable paper towels. Turn off faucet with paper towels. If your fingernails are not clean or hands are still visibly dirty, rewash your hands. Pretty straightforward, right? Although hand washing is preferred, hand washing disinfectants, hand sanitizer, can also be effective. So the optimal level of the hand sanitizer has to be a minimum of 60% for a duration of 20 to 30 seconds. Not acceptable for major events, very dirty events, or after you use the bathroom. Okay? So in a pinch, you can use hand sanitizer. It is preferred to wash your hands under a stream of water. So these are the 4 different types of agents that can be used to clean and sanitize your space. The The first one is a chemical agent. So a chemical agent is any sort of cleaning tool that you are using to sanitize your space. It can be alcohol, hydrogen peroxide, bleach, etc. An antiseptic is what we use to cleanse and clean our client's skin. So examples of this are green soap, Hibiclens, and isopropyl alcohol. We use a lot of baby wipes in here because they contain alcohol. So that is considered a good antiseptic.
Is that only true for baby wipes and not like a wet one? Or do wet ones have alcohol too?
So wet ones I wouldn't use on the face. Read on the back of them to see what the ingredients are. It's always good to read your ingredient label for sure. But it might be too strong of an alcohol to be using on the face. So you have to be careful with that. But yeah, baby wipes are gentle, and you don't want to do anything that's with an antiseptic that you are causing any sort of trauma to the skin before you're about to open it up, because it can cause their skin to be irritated before you work on them. You're already going to be wiping and working so much. You want to be very gentle with the antiseptic at the very beginning. Um, Then we have our disinfectants. So disinfectants, you have to use a broad spectrum chemical disinfectant that is EPA certified and hospital grade in your space in order to completely have it cleansed. So all of those terms, broad spectrum, EPA certified, hospital grade, have to be present on the chemical bottle itself. So this isn't one of those things that is that you won't know. You need to be able to read it, and it says those exact words on there in order to be able to use in your space and for it to do the level of disinfecting that we need. Um, Bottom line, read your labels. Like all your labels on your bottles, they're going to tell you everything that you need to know for cleaning, how to clean, how long it needs to sit on the surface, if you're supposed to use gloves with them when you use them. All of that information will be on the bottle, and in those safety sheets that we'll talk about. So disinfectants are chemicals that are used to remove or inactivate microorganisms in inert surfaces. However, they do not necessarily kill all microorganisms. That means that there can be some bacterial spores that are resistant to those disinfectants. Therefore, using a disinfectant is less effective compared to sterilization. However, we are not able to sterilize our spaces. That's not a thing. So the word sterilize cannot be done to like our chairs. Our tools can be sterilized, and that's what we'll talk about in a minute. But our spaces, it's impossible to sterilize our spaces. So we have to reach the highest level of disinfection, but you have to know that there can still be spores present. So that's why if you take your last client on Saturday evening, you don't have anybody in your space on Sunday or Monday, you take Tuesday morning a client, you have to clean your space before that client comes in. You don't have to do to the level of disinfection that you did after you just cleaned up on Saturday evening, but you do need to wipe it all down again. So a great thing to wipe down with hydrogen peroxide, alcohol. You don't have to use like a cavi wipe before they come in, but you do need to wipe your space down again just to make sure you're ridding of any spores that could have erupted over the weekend. You guys know what spores are? So it's gross. So spores are essentially like you can think of it as an egg. So like a microorganism, if it's erupted and it's in its form, when you disinfect, can keep you can get rid of those the mature teenager or adult versions of the microorganism, but the eggs can still be present and they can be resistant to your disinfection. But over the weekend, they could erupt. So those eggs could essentially hatch, right? So we need to make sure that when we come back, before we work on anybody, we're wiping that space down again. Gross, I know. um, So you will need to use strong disinfectants on anything that comes in contact with blood or fluids. Um, the strongest disinfectant that we can use in our spaces is Cavicide. So those Cavi wipes. They are incredibly dangerous to get on your skin directly. So please make sure you wear gloves when you're using them. Can directly affect your liver. My mom used them for years without gloves, so I hope her liver is okay.
I'm like, I don't ever wear gloves.
Wear gloves, Amy. It's so bad. You need to detox your liver. Um, so you Cavicide is great for right after you've worked on a client, but like I said, you don't need to use them right before, after a weekend again, or the next morning. But something simple as spraying your space down with hydrogen peroxide or alcohol is sufficient. Mm-hmm. If the surfaces have already been disinfected, you need to wipe down isopropyl alcohol. So the alcohol has to be 70% minimum. And like I said, always follow the manufacturer's recommendations. Don't just think you know. Follow those manufacturer's recommendations because they would have said that. And another agent is a fumigant. So you guys will not be dealing with fumigants, but I still will talk to you about them. So a fumigant is a cleaning product that produces fumes into the air and can kill any sort of airborne viruses that are present. Um, it's a technique of removal of very harmful microorganisms in an area that you have to use a gaseous product. So pesticides are an example of a fumigant. If you think for whatever reason you might have bed bugs or anything like that, then you can use a fumigant. It can suffocate and poison the pests within that area. There was a time where during COVID that they were using fumigants to try to kill off the spores in between rooms, in between patients that had been in there. So we did see fumigants during that time, but then they found out it actually wasn't even working. So yeah, it didn't actually even help because it wasn't airborne. It didn't even matter. But um, these are the types of fumigants that are gaseous. So formaldehyde, ethylene oxide, methyl bromide, hydrogen peroxide vapor, and chlorine dioxide are all gaseous fumigants that if something really crazy came through your room or in the future, I hope we do not, but if we see something more dangerous than COVID, potential to use a fumigant to get rid of it. So this slide just tells us the difference between disinfection, fumigation, and sanitization. Um, so you can go through just a really good slide to look back on as you're studying. It just tells you how to apply types of chemicals, what that looks like. There are 4 levels of equipment handling to reduce disease. The first, this is talking about in levels of the most minimum form of ridding of microorganisms, and then I'm going to get into the most maximum, which is surgical. So the most minimum is cleaning. So cleaning is the physical removal of pollutants from an environment. Germs are not killed, but they're denied a food source. So tools must be cleaned before they can be disinfected. Cleaning needs to happen according to manufacturer's recommendations. So this cleaning that we're talking about, this is like it's removing the source, but it's not getting them all the way cleaned. So not getting them all the way sanitized or sterilized. So for example, I'm going to walk this through as if you were going to be using a coil machine. Okay, so for a coil machine, you finished your procedure for body art. Say you guys turned into tattoo artists. You finish your body art procedure and you need to be able to sterilize your pieces of your coil machine. You can't just put them into the packages and into the autoclave if they still have blood matter on them. You have to clean them first. So, and I'll get into exactly what you would need to use because I have to teach you guys that even though we don't use coil machines, but I will teach you how to do that. Rinse them under warm water, throw them in a tub. That's usually the best way. You throw them in a tub that's filled with a solution. That's an EPA cleaning solution that gets all of that matter off of them. and then you can go to the next steps with them. The first step is getting rid of the food source. So cleaning is the food source. So the microorganisms might still be present on those tools, but we have gotten rid of the blood matter, which is the food source, okay? The next level is sanitization. So this is, we're reducing the microbial population at this point. Desanitization is the technique of cleaning and making a hygienic environment. This process is useful in making the area bacteria-free, cleaning all types of microbes and viruses that are able to infect the human body and cause different diseases. These days, hand sanitization is an essential step in day-to-day life because of COVID, as we saw. Surface sanitization is an important process of cleaning surfaces where we can remove or destroy the microorganisms. So sanitization is the highest level of cleaning that we can do um, to our hands, to our spaces, to our hands and to our spaces. The next level up from that is disinfection, which is 100% kill of the claimed organism. So this is the highest level we can reach for cleaning our space, our table. Our tables and our chairs can be disinfected. So we can't disinfect our hands. There's no way to disinfect. We can sanitize our hands, but we can't disinfect them. We can disinfect our chairs, but we can't sterilize our chairs. Now we are getting into surgical asepsis. So sterilization is the process of destroying all of the bacteria, all of the fungi, the viruses, the spores, all the living matter, all of that. And it can only be done with these two methods, which are moist heat and dry heat. So moist heat is an autoclave. Have you guys all seen an autoclave? Do you know what it looks like? It's like, yeah, pressure chamber. How it works is it has a three-part relationship. It works with time, temperature, and pressure. The temperature has to be a minimum of 250 degrees Fahrenheit, pressure 50 psi, and time is 15 minutes. Your autoclaves have to be registered with the FDA. So if you guys ever get into this for whatever reason, if you get an autoclave, it will have a like an information label on it, and it has the serial number for that particular autoclave. It also has phone numbers on it for who you contact for saying you tie your name to your machine, and that way, if you have any issues with it too, they can walk you through it. They have like dental offices. All of dental tools are, they use an autoclave. So body art, tattoo shops. Another option is the dry heat oven. Now, this is not recommended for permanent makeup quite like an autoclave is. Autoclave is much more reliable than a dry heat oven. Dry heat has to once again be registered with the FDA, but it works on a two-part relationship. It's just time and temperature. So the temperature is much higher. It's at 340 degrees Fahrenheit for 1 hour or 320 degrees Fahrenheit for 2 hours. So obviously not nearly as convenient because it takes a long time. So here you go. Here's the procedure. Okay, so how you'd handle them, you wash them with soap and water first. You rinse them, you dry them. Then you immerse them in a disinfectant. So rinse them with soap and water, get the dry blood matter off. Then you put them into an immersive disinfectant that's recommended by the EPA. Rinse them, dry them. Then you place them into packages. So one item in each package. You have to date the packages. You can get the packages like from Amazon. They're just autoclave packages. And they're specific to autoclaves because they have a little strip across the top of them. And after you have, after it's ran a full cycle, that strip needs to have changed colors. And if it doesn't change colors, it means that it did not go through the process correctly. So you would need to either try again, still didn't work, then there's something going on with your autoclave. You need to call and have it serviced. And items can be used for 1 year if left unopened. If you are working with pre-sterilized single-use disposable products, then you don't have to worry about any of this, right? It's easy peasy, you open your packages. So they are typically sterilized ahead of time with ethylene oxide gas. So when we get those needles and those different things that are in those packages have been through a process using ethylene oxide gas that has sterilized them within their packages. So they come to us sterilized. How to store pre-sterilized products. Make sure that they are covered in a container, not being contaminated, that you aren't opening a product and then not using it. If you open it, you have to either use it or dispose of it. Has to be 8 to 10 inches from the floor minimum and 18 to 20 inches from the ceiling minimum. All packages should be labeled oldest, and then you use the oldest first. So label them with your dates. Okay, so safety sheets. We are supposed to have a record of all of the chemicals that we are using in our space at a time. The safety sheets are basically a detailed information document that is prepared by the manufacturer that tells us how to properly use the chemical that we're going to be using. So it describes the physical and the chemical properties of a product. Basically, they are sheets that are used to keep track of the chemicals you're using. If you can use the guidelines from OSHA, like we talked about yesterday, and create your own, you're able to do that. If you can't, but very easily you can find safety sheets on the product that you're using. What are the 6 required items that must be included in your safety data sheets? Have to be a summary of the MSDS requirements. The name of the chemical has to match the label on your chemical. The chemical name and the common names of the substance, a listing of the ingredients, a statement of the ingredients that are known carcinogens or that are known hazards of that particular chemical. You can keep a notebook of your sheets. You're required to have those OSHA signs that can count as a safety sheet upon inspection. And like I said yesterday, you can call OSHA and have them send you a sign. Basically, the OSHA sign just tells you to follow the manufacturer's instructions for your chemicals. So I do think it is very important for you guys to know what type of chemicals you're using in your space. And so definitely, if you're not going to print out and actually contain the safety data sheet, I do think you should look it up and know exactly what you're working with at the time. So see, they're very easy to find. So this is Cavicide safety data sheet. So it's going to have the product name, tells you how to use it. So use it on hard surfaces. It's a disinfectant. So that tells us, we learned disinfectant is the highest level of removal of microorganisms before sterilization, right? So it works as a disinfectant. So that's, we see that, that's a check mark. That's good. That's something we want to use for our spaces. And if you have any issues, call this number. It tells you that it's flammable. It's an eye irritator, and we don't want to get it in our water. We don't want to drink it. It is a combustible eye irritant and harmful to aquatic life. So you don't want to clean your fish tanks with it, essentially, is what it's saying. So, and then it tells you what to do. Keep away from heat, hot surfaces, sparks, wash your hands thoroughly after handling, avoid release to the environment, wear eye protection. If you get it in your eye, rinse your eye. So yeah, so this is just a example of what it tells you where to handle it, which is, I think, important. Some of them tell you to not keep them in the sunlight. It can reduce their strength. So store at room temperature. So you don't want to go pick it up on your way home and leave it in your hot car overnight, things like that. So it's good to know. This says in case of repeated or prolonged contact, wear gloves. Usually, though, they say on the bottle, make sure you wear gloves. So like this particular Cavicide is 7 pages of data sheets for Cavicide. So just good to read through. So PPE is our personal protective equipment for what we need to use to protect ourselves from exposure to bloodborne pathogens. What are PPEs? It's anything that you can use to protect yourselves. So face masks, eye protection, gloves, anything like that. Gloves are definitely the most used PPE that we use in this field. Your gloves should be non-latex. So encountering problems. What do you do if you have exposure to a needle stick like we talked about? Um, they tell us to not panic. So if you're working on a client and you happen to get a needle stick, if you happen to stick yourself, let's walk you through how to start it, how to handle it. Excuse yourself while reassuring the client that everything is okay, assuming that your client is in a position for you to be able to leave them. If they're not, you need to ask somebody to come in. So it is an immediate thing. It's not like, oh, I just stuck myself. I'll wait till after this appointment to take care of it. Nope, you need to take care of it immediately. So you can ask somebody to come in and sit with your client if need be. Um, you're going to remove the area that you stuck yourself. So if you stuck yourself on your leg and you're wearing pants that day, you're going to need to pull your pants off to wash the area with soap and water really, really well for at least 1 minute. Dry the area and apply a bandage. Then you have to create an incident report. So you have to tell your client what happened. Um, if you I think it's smart to have incident reports printed up already, but if you don't, you could simply um, just write one out. So what has to be on the incident report? It has to have your client's name, the date, the time. Was the client informed? Simply a signature from them says that they were informed, how it happened, and where it happened. What do you do if you have contaminated items that get spilled? So say you have your trash can that has the entire day's worth of um, wipes and contaminated products in your trash can and you tip it over. How to handle that? Well, of course, make sure you're wearing gloves when you pick it up. And then you're going to need to spray the area of where it had landed. Even if there's no obvious signs of anything going onto the floor, you still need to wipe the floor down with a disinfectant. If you happen to spill like a pigment cup that you know contains blood matter, then you have to, in that case, take paper towels to blot up the area. Of course, wear gloves, then disinfect the area and throw away those paper towels as well. Pre-procedure protocols. So, of course, before a client comes, we need to protect our space prior to them coming. We need to bag our bottles, our machines, our tube sleeves, put barrier film on our headlamp, chair adjuster, table and chair coverings, apply our dental bibs to our areas. Amy gave us the great idea of putting barrier tape on our phones as well. So make sure you have your Q-tips, your wipes, your sterile water pigments, the anesthetics, pigment caps, tweezers, marking supplies, measuring materials, saline, wetting solutions, mirror, anything that you think that you're going to use on your client, have out on your table already. That way you are not having to open up cabinets or drawers and after you have already been working on your client, because that's just more areas for you to have to disinfect later on, right? So try to pull it all out. If you do happen to have to open something or touch things to get into something else, remove your gloves. That way you're not contaminating the area. Wash your hands, get whatever you need out, reapply gloves before you start. So glove changes need to happen anytime you are going to touch something else with contaminated gloves or coming back after touching another area in your space. Does that make sense? Always check for burrs in your needles. So if you open your packages with needles, check your needles because sometimes every once in a while you'll get one that has a little hook on the end. So for some reason when it was being manufactured, it must have been dropped or damaged somehow. It does happen. So look at them. If you happen to forget to look at them and then you start working on your client, you'll know immediately something's wonky because it will tug at the skin. It's almost like Velcro. You can feel it pull, and at that point, inspect your needle, see what's going on there. So it'll just be a little tiny hook at the end. So just throw that needle away and get a new one. Um, it's also painful for them and it'll cause extra bleeding. So you'll know something is not right. So during your appointment, everything that you touch, make sure that you are keeping it isolated to where you know that you have to disinfect those items rather than putting things back and forth, back and forth. For example, you're working on a client, the pigment that you want, the pigment that you originally thought you were going to use, you need to warm it up a little bit. So you grab an additional pigment off of your shelf. Make sure you keep it where you know you have to disinfect it. Don't put it back on your shelf with dirty hands, right? And I think this is our last slide of this little section. Post-procedure protocols. So you guys will have kind of your own routine of how you finish when you are working with the client. It might be that you just did a microblading eyebrow. They're sitting with their pigment soak and you want to kind of jump on getting your space cleaned up because you have a tight day. So they're on their pigment soak and you can start kind of picking up and cleaning up a little bit. Could be that you have to check your client out and you have a very quick amount of time that you have to quickly go through and clean everything. You will get faster, but at the beginning, definitely give yourself enough time to make sure that you are cleaning your space accurately. So what you need to do is you need to remove all your barrier film, dispose of any single-use items properly, disinfect your items such as your overhead lamps, apply new barrier films in between clients, remove all of your chair coverings, disinfect any surfaces, apply new coverings if that's what you choose. If using reusable products, place your products in dry, leak-proof, puncture-resistant containers with a biohazard label for transport to the disinfecting sterilization area. So for example, if you happen to ever use a coil machine, you guys happen to jump into that, you would have essentially a tub or a container that is a biohazard container. Typically it can just be like a good Tupperware container, and you would put all of your items into that container until you can properly clean them and disinfect them. So they can stay locked up in that little bin until you get them to a place to rinse them with soap and water and your disinfectant. And then dispose of items that were not used. So your Q-tips, your cotton swabs, etc. Throw those away.